acids from Alan's keynotes, and we have so far discussed some interesting acids, that is carbolic acid, benzoic acid, and other acids which are important and integral. And uh, these acids have been kept in the end of the discussion of Alan's keynotes, which is going on since the last 3 months. One remedy each day, or 3-4 remedies a day, depending upon the schedule and how we can maneuver the day. Today we'll discuss fluoric acid. Now, as I've discussed earlier in many videos, that acids as a remedy or as a group, you will be able to prescribe only in stages where the disease has progressed after a long time, or has been persisting for a long time, or it has affected the deeper tissues, vital elements immediately as soon as its onset. So we are discussing today fluoric acid, which is actually a interesting remedy. You will be employing it in lot of dental troubles and bony troubles. So let us read. It is a remedy which is suited to complaints of old age, premature old age, syphilitic mercurial dyscrasia, and young people which are looking old. Now, if we remember at least this line, young people which are looking old, and try to find out the other remedies which we have so far discussed, our job to prescribe remedy in such cases based upon observation only becomes so much easier, that we just then need to confirm the modalities or particular symptoms from the patients and quickly get into the case. Lycopodium is one of the remedies, Paritacab is one of the remedies, Natramir is one of the remedies, Sanicula is one of the remedies. In such a way, you will be able to observe and decide group of remedies that you can think of. I am not telling that you should be prejudiced right from the beginning, but you can give a thought to these remedies, or you can make a note of it and go to the further aspects of the case depending upon how the patient tells you the symptoms. Next you see is increased ability to exercise without danger. So they don't have any time and dimension of what their physical body is or endurance is, and they just to keep on doing stuff without realizing their strengths and capabilities. This is very much like agaricus we have studied, but over here it is more of other aspects, whereas in agaricus it is idiocy which takes them to that level. In fact, bufo also. The other remedy mentioned over here is coca. Fluoric acid is less affected by excessive heat of summer or cold of winter. So it's a remedy which is like Merxol, extremes of heat, extremes of cold, something that is in between. And here it is not affected by either of it. He is bindas, he is totally upfront against all the weathers. Now, what is the seat of action? Patient complains about some complaints, and the seat of action, if you understand, varicose veins, ulcers, obstinacy, long-standing cases in women who have born many children. In fact, you can think of this remedy as an intercurrent in all the cases of varicose ulcers, varicose veins, as a once a week or once a 15 days remedies, along with the constitutional which is going on. Varicose veins in young people will be greatly benefited by remedies like calcarea, ferrum phos. In people who are young but looking old, fluoric acid is the remedy that can be benefited. It is not essential that acid element has to be there on the physical level or in the mind level as a thematic level, like there has been a constant struggle and then collapse. It is not essential. If you see deeper, the tissues were going through that part of collapse, struggle, and now it has collapsed. So that is the essence of the acid which you see over here in fluoric acid on the physical level rather than on the mind level. Next you have is nevi flat, children, right temple, capillary aneurysm, compare calcarea fluor and tuberculinum. So these two remedies are going to be your sheet anchors for prescribing in cases of all these birthmarks, moles which are carcinogenic or which are dangerous to their body. Old cicatrices which become red and around the edges threaten to become open ulcers, causticum and graphitis. So those patients who have cicatrices and lingering for a long time, silica, causticum, graphitis, fluoric acid should be given maybe everyday basis or every few days. Ulcers, red edges, vesicles, decubitus, copious discharge from those ulcers, aggravated by warmth, better by cold. Violent pains like streaks of lightning. We see the streaks of lightning pains in diascoria, in phytolacca also. So these remedies should click your mind when you are doing the analysis. And especially over here, fluoric acid is like kali bichromicum, confined to a single spot. It is having pain in just one spot. Caries and necrosis, especially of long bones, psoric, syphilitic, abuse of mercury or silica. Agnus castus is the remedy mentioned. Fluoric acid can be thought. So mercury and silica are like very inimical remedy. They have parallel running sphere of actions, mode of action, pharmacodynamics, modalities. So this remedy is going to be useful in cases where you have used both of those remedies or either of those remedies and you have found no result in those cases. Rapid caries of teeth, fistula dentalis, lacrimalis, exostosis of bones of the face. You see that the remedy fluoric acid is going to be very helpful. All those patients who are landing into root canal therapies, or you need to defer it, or you need to put in some granulation in those fistulous processes, think of, especially where the bone is involved, think of fluoric acid. Hekla lava is another remedy which also will contribute, but Hekla lava will contribute more to the pain and the bony element. Fluoric acid will contribute to the fistulous process, which is important for filling up the cavity, and that's what your remedy fluoric acid will do. Complementary, you see the one remedy complementary is coca, and the second remedy that is complementary is silica. Now fluoric acid as a remedy, it has compatibility with many other remedies on many levels, like arsenic on the level of ascites or in drunkards, Calicarb in hip disease, cophia or symphyte agria in sensitive teeth, and you see phosphoric acid in diabetes. So all those cases of phosphoric acid or diabetes where you are giving phosphoric acid or you are thinking of giving phosphoric acid and you want to give a second thought to the remedy phosphoric acid, you can think of fluoric acid as well. You can think of silica and symphytum in all the cases of bone troubles, osteomyelitis or caries of bones. It can be teeth or it can be any other part of the body. And in goiter, when we think of iodine, we think of spongia. We should give a thought to fluoric acid also. Very rarely prescribed in thyroid. In fact, under prescribed, never prescribed. We are abusing thyroidinum left, right and center. We can explore fluoric acid from the element of thermals, from the element of past history of teeth troubles, from the element of varicose veins or varicose ulcers, and give this beautiful remedy fluoric acid, which has wide range of action on the goiter, on the thyroid gland, bones or teeth. So that's what sums up in short about today's session about fluoric acid, and we'll next meet up with the next acid in discussion. And I hope this has helped you. If it does help you, let me know in the comments. So some useful content will be coming soon to keep yourself updated with innovative ways and refreshing ways to learn homeopathic materia medica.